I'm now going to discuss the mechanisms of antibiotics. There are three major ones. Some antibiotics interfere with cell wall synthesis or maintenance. They can interfere with nucleic acid synthesis, or they can interfere with protein synthesis. These three mechanisms will help to start delineating antibiotic classes. This gray oval will represent a bacterial cell with its nice thick cell wall. For the purposes of this diagram, it won't be necessary to discriminate between gram-positive and gram-negative cell structure. And let's start with those antibiotics that inhibit cell wall synthesis or function. First and foremost, these include beta-lactam antibiotics. This is a very diverse class of antibiotics which has subclasses and sub-subclasses. It can be broken down broadly into penicillins, cephalosporins, carbapenems, and monobactams. I will talk more about these in a few minutes. Included in this general category is also vancomycin and daptomycin, which despite the similarities in their names and their coverage are structurally quite different. And there are the polypeptides. The polypeptides include bacitracin, which is a major component of common over-the-counter antibacterial ointments, as well as colistin, a relatively toxic drug used for only the most highly resistant Pseudomonas and Acinetobacter infections. The next category is those drugs which inhibit nucleic acid synthesis or function. This can be a consequence of inhibition of the enzymes DNA gyrase or topoisomerase 4, as is seen with the quinolones. It can be the consequence of an inhibition of folate synthesis, as seen with a specific antibiotic combination trimethoprim sulfamethoxazole. And it can be the consequence of the generation of free radicals, which interact with the DNA strands, leading to DNA damage, as occurs with metronidazole and nitrofurantoin. Then there are the drugs that inhibit protein synthesis, that is, drugs that work on the bacterial ribosomes. Those that inhibit the 50S ribosomal subunit include the macrolides, clindamycin, linezolid, streptogramins, and the much maligned but highly effective chloramphenicol. Those that inhibit the 30S subunit include the aminoglycosides, tetracyclines, and the relatively new antibiotic tigecycline. And for those of you who are wondering if there's any reason to remember which inhibit 50S versus 30S, there really isn't, except for tests. In reality, actually in clinical practice, there's absolutely no reason to make that distinction.